Good afternoon, everyone. My name is Anna. Today I'm not sharing about my diabetes issue. I'm sharing on behalf of my mom, how she has benefited M-Life medical device. A bit of background about my mom. She's in 2014. She had a heart valve replacement that we put metal valve in her, so that she don't need to go for more operation in terms of her heart valve failed again. So she requires warfarin, which is a blood thinning medication on her. So if in future any operation that she needs to go through, she will have higher risk of bleeding. So we thought that animal valve may die off very fast, so we use metal valve. But who knows in 2008, she had the heart valve change in 2004. 2008, she had this flesh-eating bacteria that attacked her. Many people who have seen her during our Port Dickson trip thought that she amputated her leg due to diabetes, but she's not. She got attacked by this flesh-eating bacteria that eats up her entire leg all the way to the hip bone, and her abdominal area was also affected. Then she has an ileostomy bag to support her passing out of pools. And why she cannot have it on the large intestine, because it was affected then, so they have to create an ileostomy bag on the smaller intestine. So her absorbance of nutrition will be affected also. Then a year later, she had kidney stones. And after we blast away the kidney stones, it returns again for 1 more year. It came back again. So the doctor decided not to blast her anymore because it will keep coming back to her. And if we keep having her kidney stone there, what she'll get next is UTI, urine infection tract. She has UTI. She needs to go into hospital to clean it. She goes hospital so frequent, it's like as if she go for staycation. Her staycation can last from 7 days to a month or so.
I feel very stressful because your mom seems to have a lot of problems.
Yes, I'm also very stressful because I'm the only child.
So I guess today's sharing is about the abscess and swelling on the right leg.
She got her diabetes 3 years ago. And she had a swell recently on starting from May to 29. We do not know whether it was insect bite or whatever. So she had this swell, and she refuses to go in to check. But until June the 2nd, if past midnight, this is the 3rd. She cannot take it anymore. She admitted to NUH. And she has to be operated on it. Pardon me for next few slides because it can be, some of you may not be able to take it.
So this is an infection of the internal.
Yeah. So they have to clean it up because there's pus in it. So when they clean up, they cannot stitch it back. Because if they stitch it back, right, they will have more pus. So she has to go through a daily cleansing, alternate days. Yeah. So this is the operation on the 4th. They have to dig up more skins underneath her to really clean her. And all of us know that being a diabetic patient, especially for leg, it takes very, very long to heal. And if you do not take care of the wound, it may not be healed and your leg will be just gone. Alright? And she was discharged on the 6th of June. And this one is the measurement. Doctor gave her 3 days of antibiotics to take. But however, when we get back to polyclinic, she developed some swelling. You can see the redness. Maybe you cannot see very clearly. There's a redness and stuff like that. And the measurements on the wound. So they started her on 5 more days of antibiotics. But then again, that was the time when I was liaising with Cynthia. How best can she be on this medical device? So after consulting Tao Xiong, we put her on 2 hours of EPT and to monitor her condition. So on the 10th from 9 June onwards, she slept on the mattress. On the 10th June, you could see the swell actually subsided very much. The redness is actually not there. And you could actually also see the wound measurements. The smaller wound dropped by 1 cm then. On 12th of June, we went back. You could see slowly the wound gets smaller and smaller. But what we want is not just the wound to get smaller, because if the wound gets smaller and close it up this way, it will not help because below is still hollow and the abscess will still be there. What we want to achieve is for the flesh to rise up from the bottom. So from 15 June, it gets better, smaller, cleaner, healthier wound. Okay, and you could see on 25th, between 15th to 25th, okay, in between we went for hospital check and they do the wound cleaning. I forgot to take the measurement. But you see from this 10 days onwards, when we found that she could sleep better with 2 hours, every time when she's on resting, I'll just go and press 2 hours day or in the afternoon. Then in the middle of night, okay, let's say she sleeps at 11, I'll just press another 2 hours, and I get up at 4 o'clock. I just press another 2 hours, so that those speed up her recovery through deep sleep. Okay, and from 28 onwards, you see 2.4 for the big wound. It went down to 1.9. Within that few days, the wound went down by 5 cm. So much of self-healing has taken place through this medical device.
I think we take a look at this picture as what Anna was mentioning, not just the wound closing up, you could see the flesh actually start to fill up the gap that's in the wound. So that's the main purpose of the therapy.
Yeah. Okay, this is when we do a home dressing. Just from alternate days that we go for dressing, slowly the nurses from Poly says that you can come after a week. So in between, okay, we do the cleansing for her. Okay, and she was not in pain. Even we clean it on her, she doesn't feel painful, she was okay. Her threshold was very high, I guess. Yeah, for me, I faint. Okay, so yeah, this is on 5th July. Okay, the wound gets smaller, healing up, flesh coming up. It's very healthy. The nurses also got surprised how come, seeing, because they see a lot of diabetic patients every day to wash their wounds, and hers is like, very clean cut and stuff like that. And this is what we did on the 9th of July at home also. It gets smaller and smaller, better. And this was yesterday that we went back to polyclinic to get it washed by them. You could see, as days goes by, it gets really small, the wound, and it's growing very well. Yeah, and I'm very thankful for this medical device that has brought into Singapore, okay, for all of us to use it, which I benefited, my mom has benefited. Okay, I'm a believer. I would like to take this opportunity here on stage. Okay, I have not grown my eagle wings yet, okay, but I will seize this opportunity. From the bottom of my heart, I would like to thank you, our founder, Mr. Liu, for God's wisdom to you, His far knowledge for you, in terms of knowing how this electric potential can help people on our self-healing. Okay, when it seems there's no alternative, yet God provided you, through you, provided us an alternative options through electric potential. Thank you very much. Thank you, my leaders, Tao Xiong, Cynthia, Stephanie, Henry, as well as Casey, for always there guiding us. Also, thank you very much for the family friends that I found in this family, like Jessie, Mui Mui, Esther, Grace Ong, okay, and many more, for your support and guidance and your encouragement, as well as Joyce also. Okay, and most importantly, I also want to thank you for Henry. If not for Henry, who has come contact with Tao Xiong in one of his JB encounter sharing program, I would not know when would this device come to Singapore. So thank you very much.